Hi, everybody. We've got just a couple more minutes, and then we'll get started. People are starting to join. We had 100 sign up. It looks like we have 16 people joining us so far. So again, we'll give it a couple more minutes, and then we'll give it a go. Thank you. You can see me. I'm the person that's talking. My name is not Shannon Moniak. It is Kathy Foley. So Shannon Moniak is the organizer for this web system, whatever. You can tell we're new to this, so bear with us. Okay, where's my change speaker now? Oh, wait. Hi, everybody. If you can see me, I'm not sure how this works yet. We're brand new to webinars and all this, so bear with us. Hopefully we won't hit too many technology glitches. But my name is not Shannon Moniak. My name is Kathy Foley, and I'm the current Executive Director of Services for Independent Living. Shannon Moniak is the incoming Executive Director. And so I want to thank you for joining us. Like I said, this is our very first webinar, so let's see what happens here. But as a lot of you know, in the past several years, we have had local Northeast Ohio transportation equity forums. And this year, because of COVID, we had to figure out a different way of sending information out. So we're trying the webinars. So this is the first one, and the topic is Vital Connections, Expanding and Protecting the Rights of People with Disabilities in Public Transportation. And with us, we have Katie Hunt Thomas, who is the Disability Rights Attorney for the Ability Center of Greater Toledo. And before I turn it over to her, I want to do a little bit of housekeeping. So hopefully everybody can see these slides. Just know that you are going to be muted. And if you have questions, please put them in the chat box, and we will answer as many of them as possible at the end of the session. If it goes over and we don't have time, we do have people's contact information, and we will get back to you. If you need social work credits for this webinar, as you know, when you go to a conference, you have to sign in and sign out. Well, we can't do that here in the typical way. So I need anybody who needs social work credits to sign in the chat box. All you have to do is put your name, say you need social work credits, and then if you have your license number, that's great. If you don't, we'll figure it out. And then at the end of the session, before you sign out or before you log off, you need to sign out in the chat box again. That's your sign in and sign out. If you need a certificate of attendance, please do the same thing, but say that you need a certificate of attendance. And those that signed up for CRC credits, hopefully you received an email from Carolyn O'Connor from OOD. We were not able to get credits for CRCs, but we were able to get 1 credit for social workers. So with that, I would like to turn it over to Katie Hunt Thomas. Thank you.
And just give us a minute because we're also trying to figure out how to work the technology. So are you able to share, transfer the screen?
I can, do you want me to share your slides? Or do you want to share the slides?
Oh, I guess either one would work. Okay. Well, good morning, everybody. Like Kathy said, my name's Katie Hunt Thomas. I am a lawyer with Center for Independent Living in Northwest Ohio, which is called the Ability Center of Greater Toledo. We are doing a series of presentations ourselves on a new booklet we developed, which is called the same title of this presentation, Vital Connections, Civil Rights and Public Policy Issues Affecting People with Disabilities in Pursuing Inclusive, Accessible Public Transportation. Just before I get into our presentation, these booklets are available for free for anybody who would like one. We also have an electronic copy that we can distribute if you're interested. And I'll be talking a little bit about the booklet in the presentation. A little, I guess, just one housekeeping thing from me. We are in this new post-pandemic world. So if you hear sounds in the background, it's probably my 2-year-old either playing the ukulele or roaring like a lion. So just bear with me that we're still dealing with that as well. Okay. Kathy, do we have the presentation?
Do you want me to put them up? I can.
But I need
go ahead.
But I need the share screen.
Yes. And if you have trouble, I can put your slides up and you can just tell me to advance them, whichever is easiest for you.
Why don't you just have me share my screen or just share?
Okay.
I can do it.
You share it, right?
Yes, I will share it.
Okay. We're learning, folks.
Last time there was a little button that I could press that I could share my screen.
It should say share screen.
I don't have that option right now.
Okay, do you see I'm sorry, folks. Do you see a screen icon? We did
No.
do a dry run of this, guys, by the way. So.
I don't see a screen icon.
Okay, well then let's try this.
Okay, let's do it this way.
Okay.
All right. Like I said, we just put together a new booklet. It's called Vital Connections, Civil Rights and Public Policy Issues Affecting People with Disabilities in Pursuing Inclusive Accessible Transportation. And then that's me, Katie Hunt Thomas, the Disability Rights Attorney and Director of Advocacy at the Ability Center.
Just tell me next slide whenever you need me to go.
Okay, next slide. The next slide, Kathy.
How about that? Is it showing?
No, we're still on the first slide.
Okay, it's showing on my end. Katie, you might just have to go without your slides.
Okay.
I'm sorry.
That's all right. Like she said, we did do a dry run of this and I was able to share my slides. So sorry about that. The presentation, I think, is already listed in the handout section of your control pad, if you want to take a look at it. I am from the Ability Center of Greater Toledo. We're a center for independent living in Northwest Ohio. We serve 7 counties, and every one of our 7 programs is designed to support folks with disabilities to live independently in the community. So we don't provide housing, we support folks to be as independent as possible in the community.
Is that showing?
Yeah,
Okay.
there we go. All right, we're online. The booklet that we produced covers the rights of people with disabilities under the Americans with Disabilities Act in transportation, some tips and tools on how to expand funding for public transit, and then also disability issues in transit technology. So I think everyone on this podcast or on this presentation is probably aware of the technological revolution coming in public transit in terms of autonomous vehicles that are coming down the line, and then ride sharing apps like Uber and Lyft. It's changing what public transit looks like in ways that the ADA didn't anticipate, but the ADA still applies, and so we have some issues to watch in that last section. And then next slide. This presentation is not long enough to cover all those things. So we're just going to go a brief overview of the access to public transit under the Americans with Disabilities Act. And then I am going to talk a little bit about issues in the time of COVID-19, because that's a hot topic right now, and a little bit about expanding public transit networks. Next slide. So the theme of our booklet all goes back to whether, this question, is transportation a civil right? So before the Americans with Disabilities Act was passed, transportation, the access to public transportation, was identified by people with disabilities, the ones who advocated for the ADA, that as being one of the preeminent civil rights issues for folks with disabilities. So pre-ADA, there was no access to existing public transit systems in the United States. Today, access to public transportation is still one of the preeminent civil rights issues for folks with disabilities. But the landscape looks just a little bit different because the ADA was passed. So the booklet that we've produced and the issues it's trying to address all go back to this issue of, is transportation a civil right? And so just talking a little bit about this slide, what I have there is a picture of ADAPT, or the American Disabled for Accessible Public Transportation. It's a national, for those who don't know, it's a national grassroots group for folks with disabilities that did a significant amount of organizing to get the ADA passed and other acts that predated the ADA. And one of their major issues was this issue, access to public transportation. And this is a person being arrested from an ADAPT protest in Detroit, where it looks like she was blocking a bus because she couldn't get aboard. Next slide. And the next slide. Next slide.
Apparently, it doesn't want to show if I am, or move forward if I am. I don't know. Okay, so let's see what it's doing here. Sorry about this, guys. Show screen. Can you see it?
I'm still seeing the same slide.
I'm sorry, folks. Keep going, Katie, and I'll figure it out.
Okay. So talking a little bit more about civil rights, you know, I'm a lawyer, so when someone asks if something's a civil right, I go to the definition. The definition of a civil right is a right given to individuals that's established either under the Constitution or in law. And so we hear this call a lot from folks with disabilities, you know, transportation is a civil right, it's my civil right. But when we ask, is it actually a civil right? The answer is complicated. So the Americans with Disabilities Act did make it a civil right for folks with disabilities to access existing public transit systems. The National Council on Disability that had a big part in recommending what the ADA should look like, recommended that disabled people have the same rights to use public transportation as non-disabled people. And that is essentially what the ADA set up in a variety and a very extensive way, as we will see. And that has had an effect. So before the ADA, which was passed in 1990, only 40% of fixed line buses were accessible. But as of 2010, 99.8% of buses were accessible. So, and then something else the ADA established was that every fixed line transit system has to have a paratransit system for folks who can't use fixed line. So those two things have increased folks with disabilities access to public transit just immensely. But what we're seeing today is that there's another side to the issue. So even though there's a right to access existing public transit systems, there's no, at least right now, there's no law or constitution or statute that requires public transit to exist at all. So we're seeing issues on the other side of the coin where folks with disabilities can't find reliable public transit to use because it's not receiving public support, it's underfunded, and then there are still areas where no public transit exists at all. So today we're going to talk, like I said, a little bit about what's in the ADA, and then I'll just give you a couple of things about increasing funding. But it goes back to that, but the issue that the booklet's trying to address overall goes back to what we were just discussing. So the ADA was passed to increase access to public transit, and it's done a fairly good job of doing that, but there are still major issues in terms of folks with disabilities' ability to access public transit. So the ADA, is one of the biggest things it regulates is public transit. This was a huge issue for the drafters. 22 code of regulations under the ADA deal with public transit, and then Title II of the ADA in its entirety, so the state and local government title, applies to public transit agencies, and Title III, the places of public accommodation title applies to private transit agencies. So I'm just going to be giving you a very brief overview of what's in there, but I think we're going to accomplish that. This is just a list of things that we're going to take a look at. So overall, transit agencies can't discriminate against a person with a disability based on their disability. They must communicate effectively with riders. They're required to train their employees on the law and disability awareness. They have to offer reasonable modifications. Transit facilities, buses and bus stops must be accessible. And then they must offer comparable paratransit service. Next slide.
Fine.
You having slide trouble?
Yeah.
Okay. So the preeminent right that's established by the ADA is that folks with disabilities should be free from discrimination. So transit authorities can't discriminate against someone with a disability because of their disability. The main thing that this covers is that folks with disabilities can't be denied rides because of their disability. So any transit provider, private or public, has to allow a person with a disability to ride. They can't turn away folks because of their disability. So that also means that they can't require something additional because of someone's disability. And they have to allow people with disabilities who need something additional to access a transit bus to be able to use that. So this is a little bit different. Most civil rights laws I know just say you can't turn away someone because of a certain characteristic. And that does happen with disability. There's been reports of Uber drivers seeing a person in a wheelchair and just driving by. So sometimes transit providers do discriminate in that way, but there's a whole additional aspect of it here in disability. A couple of examples. So a person who is blind and uses a service dog, a transit provider would be required to allow their service dog to ride, and that's any transit provider, public or private. And there's also, we've heard examples of transit providers turning away service dogs, and that's unlawful under the ADA. Most big transit authorities don't do that anymore, but sometimes you still hear about it for cab drivers. Again, it's an example that's popped up with Uber and Lyft drivers. As long as you're a transit provider, that's something that you would have to allow, because otherwise you're denying someone a ride because of their disability. Similarly, from the other side, a transportation provider can't require things of people with disabilities that they wouldn't require of other riders. Usually that's an extra seat belt, things like that. But a good example is that a transit provider cannot require someone to travel with an aid. I mean, that's an example that we've heard before. Though if a person wants to travel with an aid, they can't turn them away because of that. The ADA has a list of things that transit providers are required to allow as well, in addition to that general rule. So they can't require priority seating, can't impose special charges, can't require an attendant. They have to allow individuals who use oxygen to bring oxygen with them. Those are all things specifically mentioned as inappropriate reasons or unlawful reasons to deny someone the ability to ride. The next question that people are going to have is, are there circumstances where a transit provider can deny a ride based on disability? There are some circumstances. So the exception is if someone constitutes what under the ADA is considered a direct threat. But that is a very high standard because this is a civil right, access to transportation. So the threat has to be actual. It can't just be behavior that causes annoyance. One of the examples that Federal Transit Administration gives is maybe a person who has Tourette's syndrome or autism that makes some vocalizations that some people find annoying. That's not a reason to deny a ride. It has to be based on an individualized assessment and must be based on medical knowledge and best objective evidence. Transit provider can't turn someone away based on unfounded stereotypes. That's one of the big reoccurring themes in the ADA. So the behavior really has to be a threat. It has to be violent, disruptive, illegal, or a direct threat to health and safety. The other thing is that transit providers have to look at whether they can provide something that would mitigate any risk. If there is behavior that they think would constitute a direct threat. So there are circumstances where a disability could cause a transit provider to turn someone away, but it has to be a very extreme and very high standard. So the next protection we're looking at is that the ADA requires any private or public transit provider to effectively communicate with riders. A lot of folks with disabilities were unable to use transit systems pre-ADA because they couldn't understand what was going on with the way that transit providers communicated. They have to be able to understand how to use the service, the routes, when to get on and off, the fares, and so the ADA provided this requirement for transit providers to provide effective communication to folks with disabilities. And that's a higher standard than you might see in other contexts. It has the effective communication has to be both sufficient and accessible. So they have to provide both enough information for folks to understand, where to find the bus, where the bus is taking them, how to get on and off. And then that information has to be provided in accessible formats on request. They do say, it doesn't have to necessarily be provided in the exact format requested, but it has to be provided in a format that's effective for the folks who need to understand what's going on. Some of those examples are large print, braille, audio tape, electronic files. One of the examples that's of effective communication is that fixed line buses have to make sure they're calling out stops. They're called like stop announcements, so that folks who are blind or visually impaired know when they need to get off. The next one is employee training. So this might be a surprise to a lot of people who use public transit, but transit authorities are required to train their employees on the requirements under the ADA, and then also on disability awareness. So staff must be trained to proficiency. They must be able to operate vehicles and equipment, and then they must assist and treat people with disabilities in a respectful and courteous way. One example is, drivers have to know how to operate a lift. I will say that as long as the transit authority is training folks in an effective way on these things, if you have one rogue driver who's very rude, then it doesn't go back to the transit authority. Their requirement is to provide the training. But if they aren't effectively training their staff to operate accessible equipment and treat people in a courteous and respectful way, then anything that an employee does can go back to the transit authority. The next thing we're going to talk about is reasonable modifications, and this is an important part of employee training as well, because a lot of these reasonable modifications are made on the front line by employees, so they have to know that they are required to do that. Reasonable modification is a technical term that you see throughout the ADA, but it's a pretty simple concept. So when people were drafting the ADA, they realized that some people's disability prohibit them from following policies or require some sort of exception to a policy. So if a transit authority has a policy that a person can't meet because of their disability, or they need an exception to, they're prevented from accessing a bus or a taxi because of the policy, because of their disability, then they're obligated under the ADA to give an exception. The FTA clarified this issue a few years back. I think it was maybe 2015, that this is very definitely a requirement of public transit authorities, and actually have a circular available on their website that give 27 examples of what a reasonable modification should be. Most are pretty common sense, but here's a few examples. So for example, if a fixed line bus is driving in snow and ice, and maybe there's a person with a mobility impairment who's having trouble getting from the bus stop into the bus driver would be required to assist them in getting into the bus. And that's even if the bus has a policy, even if the transit authority has a policy that a bus driver can't leave their bus, that policy should be modified to assist a person in that circumstance. And one that we've actually seen locally is pick up and drop off for paratransit. Even if a transit authority has a policy that they'll only pick up someone with their paratransit bus at a certain entrance to their home, if someone needs them to pick them up elsewhere because of their disability, let's say the policy is the front entrance, but the ramp is in the back entrance, then they would have to modify that policy and pick someone up in the back of their home. The third one that I think is pretty common sense is eating during a ride. So if a transit authority has policy that you can't eat during a ride, but someone has a disability like diabetes where they need to keep their blood sugar going, or they need to take food with medication and have to eat during the ride, then there should be a modification of that policy. So I do want to emphasize when I talk about this that the modifications that they're required under the law to provide have to be related to a disability. So for example, if someone is low income and can't afford a bus pass and asks for a free bus pass, that's not something that would be required under the law. It has to be a disability accommodation. And then the modification can't be a fundamental alteration of the program. It can't change the service that they provide. So if a fixed line bus, if someone requests that a fixed line bus pick them up at their house, but the house isn't on the route, then that would not be something that a transit agency would be required to provide. They consider that a fundamental alteration. Any transit authority should have a process to request a reasonable accommodation. Many reasonable modifications are going to be requested in the moment. Think about the ice and snow example. And so employees need to know, bus drivers, frontline employees need to know that they have to provide those. But transit authorities should also have a procedure to request those ahead of time so that everything's set up beforehand. We just have a couple more. Like I said, this is very comprehensive. I'm just giving you an overview of everything that's in there. The next thing that the ADA tried to head off was buses and facilities that are not accessible to folks with mobility impairments. So the ADA required that all new buses purchased after the ADA, all new transit facilities, stations, bus stops, they must all be built in an accessible way. Existing ones that, existing buildings, existing buses, existing bus stops are supposed to be made accessible over time. So ones that existed pre-1990 before the ADA, but anything built or acquired after that that's new or altered should be accessible. So what does that mean? The Department of Transportation actually has its own guidelines. So for folks who are familiar with the 2010 and the 1990 ADA standards for accessible design, those still would apply to new buildings that are covered under Title II and Title III, state and local government, and places of public accommodation. But transit facilities actually have their own standards under the Department of Transportation. Those can be found online. And if both standards apply based on the law, so a public transit authority would be, an instrumentality of state or local government, then whoever's building the new building would have to look at both. Vans and buses also have specific ADA standards that are set out by the Department of Transportation's accessibility specifications for transportation vehicles. All these are available online either you can get them either on the FTA website or the Access Board website. New vans must be accessible. And then the Department of Transportation standards also apply to bus stops. There's very specific requirements for new, altered, or relocated bus stops. They must be accessible. I am going to talk a little bit about taxis. I just mentioned it in there because there's an exception in the ADA for taxis that are automobiles. Those were not required to be made accessible. But any taxi company that has new vans after the ADA was passed, their vans must be accessible. Okay, this is the last one. So a lot of the folks that we work with utilize paratransit systems. In Toledo, it's the Toledo Area Regional Paratransit, TARPS. A paratransit system is actually required under the Americans with Disabilities Act. So anytime a public transit authority has a fixed line route, they're required to have a comparable paratransit system, or a paratransit system that offers comparable service. Paratransit is generally a smaller, accessible bus. It's required to pick people up either curb to curb, so pick people up at a curb and then drop them off at a curb at a destination, or door to door. So, or paratransit can go door to door, but they're required to pick people up where they call them and then drop them off at a destination. When the ADA was passed, the folks drafting it realized that some people, because of their disability, wouldn't be able to use fixed line service, and the paratransit was considered a way of making public transit accessible to those folks. Comparable means that the paratransit service has to have comparable hours and days of service. It has to have the same service area within a 1/4 mile of any fixed line route. It has to have a similar response time, a comparable response time to a fixed line bus. Fares can't be more than 2 times a fixed line bus fare. And then it has to operate without regard to trip purpose. So a public transit authority can't offer paratransit just for medical appointments. It can't offer paratransit just for employment. It has to be offered for any trip purpose, just like a fixed line bus would be. You know, the ideal is that someone could leave their house, go to a bus stop, get on a bus, know where they're going, and get there. Paratransit is supposed to offer the same service for folks who can't use fixed line. The big one that we see a lot of complaints about are capacity constraints, that last one. And that means that there can't be a lot of missed, paratransit trips are allowed to be reserved a day in advance. They must provide next day service, but there can't be a lot of late arrivals for paratransit buses where people aren't able to get to their appointments on time. Extended time in the bus, where again people are missing their appointments, or trips where they're refusing to pick people up. A big question they get is about paratransit eligibility. So like I said, the ADA, its goal was access to public transit. So the idea was that fixed line buses would be made accessible, and anyone with a disability would be able to take that service, and paratransit was offered for those whose disability prevented them from taking the fixed line service. So there are 3 categories of eligibility that are put in the ADA. That's a minimum. If transit authorities want to expand eligibility, they're welcome to do that, but they're only required under the law to offer paratransit eligibility for 3 different categories of folks. So the first is someone who can't navigate a fixed line system, so their disability prevents them from doing that. The second is where maybe some of those existing bus stops and facilities aren't accessible, so someone can't use those. Then they can use paratransit for whatever route is not accessible. And then the third is inability to reach a boarding point or final destination. So someone who has trouble getting from the bus stop to wherever they're going. And paratransit agencies are allowed to make eligibility conditional. So I know someone who was granted conditional eligibility just in bad weather because she's pretty mobile and can get on a fixed line bus by herself, but would have a lot of difficulty doing that if it was raining or snowing. Or maybe there's one bus route that is not accessible, where the bus stops aren't accessible or something along those lines. They're allowed to grant conditional eligibility for those purposes. So we get a lot of questions about that, and that is the way the law is set up. The paratransit agencies are allowed to limit eligibility to these 3 categories, and they are allowed to do conditional or temporary eligibility. So how do you enforce your rights? So a person with a disability who feels like they have had the rights violated, if any of those things aren't working, they have a variety of different places they can go. They can file a grievance with a local transit authority. Most have grievance procedures. That's honestly how we get most of our complaints resolved. We just call up our contacts at the transit authority and they fix whatever the issue is. We just recently had someone who was having trouble getting their paratransit eligibility renewed during this COVID-19 pandemic when everything's up in the air. We were able to call over to the transit authority and they extended their eligibility because of everything that's going on. If that doesn't work, there are a few ways to file complaints without attorneys. People can file a complaint with the Federal Transit Authority, the FTA. You can go to their website. There's a form you can fill out, or you can call them or mail in a complaint. And it's the same with the disability rights section of the Department of Justice. And then the ADA is enforceable in court. So somebody could get an attorney and file a complaint in a court and enforce their rights that way. So this is the hot topic right now. So there were just a few things I wanted to address with COVID-19. Everything is changing and shifting and up in the air. People aren't sure what to expect or what their rights are in many situations. The FTA does have frequently asked questions available on their website regarding civil rights and COVID-19. So that's a good place to get some answers. But just a few things from their FAQ that go to individual rights for folks. Paratransit, that they've clarified in the FAQ, paratransit agencies currently can't restrict the purpose of a trip. So even though a lot of fixed line are restricting purposes of trips to just medical appointments, essential appointments, like we covered earlier in the paratransit section of the ADA, there's a clear regulation that paratransit agencies can't restrict the purpose of the trip. So legally, they're not allowed to do that, though they can encourage folks for safety reasons to only ride for essential trips. Something else that apparently has come up is that during this pandemic, if fixed line buses have suspended fares because of everything that's going on, they also have to be suspended on a paratransit bus, so the two would have to go together. The third one that applied to individuals that I pulled out is if buses, for a fixed line bus, if the way buses are boarded is changed because of social distancing requirements, a fixed line bus service can't prevent someone from entering the front door to use a ramp if they require a ramp to get on a bus. So there's a more in-depth document available on the FTA website, but those are a few things that I pulled from their guidance that I thought might be helpful to folks. And then this is the big question that we keep getting. I know, does a transit authority have to transport a person infected with COVID-19? And there's no clear answer to this question, but I can kind of go through it a little bit with you. So the first question would be, is COVID-19 a disability that gets protection under the ADA? So it would have to be a physical or mental impairment that substantially limits one or more major life activities. And I would say it's possible that it qualifies, but would take a little bit of analysis. Maybe would probably depend on how severe it is in a person and what the effects are on their life, right? The second thing is that transit authorities do have the right to refuse a ride to a person with a disability if they're a direct threat. And actually, a lot of the case law that I've seen involving this direct threat exception does involve some sort of infectious or communicable disease. With everything that's going on right now, and the country's concern about the infectious nature of COVID-19, it is possible that would constitute a direct threat and an exception to that law. The FTA has offered some guidance, though it's not a black or white answer, which I know is what people normally look for. But what the FTA recommends is that transit authorities follow the guidance of their local public health authorities. So that they work with the public health authority to determine when it's safe to transport somebody or not transport somebody, and then they follow that advice. They do also reference that direct threat exception. So there's a good chance that the FTA would support analysis that would think someone infected with COVID-19 would be a direct threat who could be denied a ride. With all that said, I would say that it's clear that a direct threat has to be also a individualized determination. So a lot of it depends on a person's circumstances. And so people should have that conversation with their transit authority if their circumstances make them not infectious or something along those lines, or if there are steps they can take to ensure that COVID-19 is not transmissible if they're past their quarantine period. There are ways for transit authorities to go overboard in terms of denying rides to folks as well. So this is a sort of a changing area of law, but that's the analysis that I would go through based on what the ADA offers and what the FTA guidance is. Okay, so going back to that initial question, I'm sorry, we have one more slide on the COVID-19. This is just something of interest for transit advocates. Another result of COVID-19 is that our federal Congress passed the CARES Act, and it gave, I think it was $25 billion to, or $1 million to transit authorities across the country. So our transit authorities are currently being infused with some COVID-19 CARES Act funding. Just a little bit of information on that. The funding is limited to prevention, preparation for, and response to COVID-19, but it's broader than you would think in terms of that definition. So some of the things that the FTA has talked about the funding being used for is, maintaining service, reimbursing lost revenue from lost ridership, that sort of thing, ensuring obviously COVID-19 safety, and then also employee leave. So maybe folks who are infected with COVID-19 and need to quarantine, the money can be used for that too. So just keeping that in mind for folks who do funding advocacy and that sort of thing, that transit authorities have gotten some money from the federal government to respond to COVID-19. And then here's just for folks who are interested in this issue, a list of resources of places you can look for more information. So looks like we're going to finish right on time. We have just a couple more slides after this. I didn't want to, even though this presentation is focused on what rights are available to folks with disabilities under the ADA and how the ADA expanded access to public transportation for folks with disabilities, I didn't want to completely leave it without talking about the other issue that we talked about. So access to public transit is now a civil right. People have rights, they can enforce them in a court to be able to use existing public transit, but we're still seeing issues. So it's still one of the preeminent civil rights issues for folks with disabilities that there isn't enough funding to have a comprehensive public transit system in most areas. Many areas don't have anything existing at all. So I just think I can't talk about one without sort of balancing it out without the other. So we're just going to go over just a couple things that I pulled from my research, and then we'll conclude. So I really think that expanding the public transit network, the other side of that equation, goes back to funding and getting public support for public transit. We've seen over the past few years that we're at a time when this is a good message. In Ohio, where we're located, we're an aging state. We're expecting lots of folks that lawmakers, that people in our communities have personal connections to have to rely on public transit as time goes forward. And it's become more of a personal issue. Plus, there are some really good reports and studies and statistics about the need for increased public transit. So when we're basically asking for a public service for our lawmakers and for our communities to spend money on providing this service, we have a lot more, as each day passes, we have a lot more things to back us up that it's something that's needed. What we're going for in Ohio is to have, so in Ohio, public transit is currently funded out of our general revenue fund. So it's competing with every other source of income with taxes, that taxes bring in Ohio. So it's competing with Medicaid, which is a big chunk of our budget. It's competing with schools. It's competing with any public service that the government might offer. So some of the states that have sort of done it right have been able to set aside a certain portion of a tax, of a designated tax, just to go to public transit. And then that tax goes into a fund to fund it. So that's one of the things that we're working on, that we're working with great people like Kathy on, and other centers for independent living in our state. For folks who aren't in this world, really persuasive things approaching lawmakers about asking them to spend money are studies demonstrating needs, models that show other states beating us or doing it better. Personal stories. I've found that with our local districts, they want to hear how our locality is being affected. That's kind of easy to talk about in our circumstance. But personal stories, people find those very persuasive. It's hard to say no to someone giving a personal story. And then just lots of dialogue and discussion, coalitions, work groups, conferences, getting the issue out there, making it something that people are talking about, and then making the ask. So at this point, the other side of the equation seems to me to be a policy issue rather than a legal one. But I think it's something that a lot of people are working together to work on, and hopefully something that we'll all be able to work on together as things settle down from what's going on now and we move into the next, the future.
Okay. Katie, we have some questions. Can you hear me okay?
Yeah, I can hear you great.
Okay, we have some questions, but before I get to the questions, I just, 2 comments. A reminder that if you need certificates of attendance or for social work CEUs, you need to sign out just the same way you signed in. And Katie had talked about some of the work that there's a coalition, the Ohio Aging and Disability Transportation Coalition. We are in the process of starting a social media campaign. So it's brand new and it just went live this past week. If you're interested, please go on to your Facebook site and Google or look up the Ohio Aging and Disability Transportation Coalition and like that page. You'll see more cool things coming from that. So question, let me find, okay, I see some big ones here. Let's see. One is, what if the Lyft and Uber driver is allergic to the animals, the service animals?
Yeah, so that's a question we get a lot. It's actually not just in a transportation context, right? We actually get that question in like every context. The ADA has really specific regulations on service dogs, and so does the Fair Housing Act. It has really serious regulations on emotional support and service animals. The allergy question seems to be the one we get a lot, and is addressed in guidance that the Department of Justice and the Department of Housing and Urban Development have come out with. It's not an easy answer, but what the answer from them is that they have to take steps to mitigate the allergy. A transit authority can't deny a ride to someone who has a service dog. So what they recommend is that steps are taken to mitigate that allergy.
Okay. What can they charge extra if the person needs an aid or personal assistance?
No, a transit authority cannot charge extra if somebody needs an aid or personal assistant.
Okay. Here's a comment that leads to an issue. A lot of my participants say that RTA, this is, I'm assuming Cleveland area, is not reliable. It takes too long to ride a bus. In some cases, it can take an hour and a half plus one way to get to work. Is there anything that can be done about that?
And that's an issue that we have faced here in Northwest Ohio as well. So that goes to that part of, so are we talking about fixed line or paratransit?
This, I'm not sure.
Okay, so.
But I can tell you that just from experience in our area, it can be both. Okay.
So paratransit has those regulations that require it to have comparable service to the fixed line. So if the ride length from one destination to another is longer when you take paratransit than when you take fixed line, then there's a legal way to challenge that. If the issue is that it's just long rides the fixed line takes about the same time, but it's just really long, that in my experience has been more of a policy issue. Transit authorities need more funding so they can have more buses, so they can have more drivers, and they can have faster service. There are some ways to get involved in transit planning as well. That's one of the things the Ability Center tries to do. So, getting connected to your transit authority, getting connected to your metropolitan planning organization. If you have suggestions on how to make routes a little bit more efficient, giving input, making complaints. You can still make service complaints, even if there's not necessarily a legal violation. All those things, I think, help with that. The only legal issue I would see is if it's paratransit that's taking a significant amount of time longer than a fixed line ride.
Okay. Another question, and this is near and dear to my heart because I've got asthma. Can transits require wearing masks for people with disabilities? I feel that there are issues with people with COPD or other health issues.
Yeah, so that's a tricky issue. I would say that if there's a disability related reason that wearing a mask would be harmful, then that would be a reasonable modification of a policy. So if they have a policy, everyone has to wear a mask, and there's one person who's unable to wear a mask because it would aggravate their disability, then they should be able to request an exception to that policy.
Okay. Here's another comment and question. We have an issue in Columbus with traffic signal removals. This leads to long distances between safe signalized crosswalks to and from bus stops. We have asked for signals to be retained for this reason, but have been unsuccessful. We have been able to get pedestrian beacons to replace traffic signals, but the flashing yellow beacons are not audible and motorists are not required to stop at them. Any suggestions to resolve this issue? Great question, Pat, by the way.
So I just want to make sure I understand the issue. So like it's not pedestrian friendly, or
It sounds like it. You're right. And motor, yeah, it's not pedestrian friendly. Motorists aren't required to stop.
So that would be, so there isn't, so the ADA transportation regulations don't fall under, you know, traffic signals. It would be something that you would want to try to address with your city in terms of it being a safe and accessible route to pass through. I guess I'm not sure what to recommend aside from you know, doing some advocacy and getting to a decision maker and talking to them about it. I think if it's a safety issue, you should be able to make a pretty good case that they should change what they're doing.
Okay, this goes back, and it's more of a comment regarding turning away service animals, because sometimes the driver's allergy might be life-threatening. So in that case, they would not be able to have something like that in the car. It would have to go to somebody else. Let's see. Here's a update here from Pat. The reason for removals is that the traffic signal monitoring system is being upgraded, and it costs money for each traffic signal to be upgraded.
I think if you would want to contact me directly after this, so we could have a more in-depth conversation and I could ask for some information, I'd be happy to do that.
I can put you two together.
Yeah, I think to evaluate the issue, I think I need a little bit more information.
Okay. Okay, any other questions? I want to thank, first of all, Katie Hunt Thomas, I want to thank you so much for sharing your knowledge and your expertise. You are always a go-to person for us, so just thank you. For the rest of you, I want to thank you for bearing with us as we do our inaugural webinar. We've learned a lot, and it's an experience. Know that there are 2 others coming up in the next couple of Wednesdays, and they are going to be talking about, again, on the issue of transportation, on promising practices that communities can take a look at, and then a discussion with both public and private transportation providers and their response to COVID and looking to the future. So please feel free to send an email if you have questions. We've got the handouts are listed, so you can have access to that. And again, I see people are signing out. Thank you very much. And I wish you a great, great day and a great week. So thank you very much.
And thank you for having me here, Kathy.
Oh, it was fun. We learned a lot. So I am going to stop the screen show, stop showing screen. There we go. What was interesting is that with the screen, the showing of the screen, oh, we have a board member that was in there, is that every once in a while I'd have to switch ways of doing it because it wouldn't respond. At first I could click enter and it was fine. Then it would shut off the sharing screen, and then I had to click another button. Then I had to click a button, and then it gave me a list of things saying next. And then it went from one to another to another. There was nothing set. I mean, just it was wild. So anyway, it is what it is. So
yeah,
thank you so much.
Our drive run went so well. That was so easy. You just like a little button popped up that said share screen, and I could just share my screen.
Yeah.
Yeah.
So it is what it is.
Yeah. Well, I hope it was helpful for folks.
It was fun. Thank you so much. Just thank you. Yeah. So I'm going to let you go, and you just have a great weekend.
You too.